Up next is Dr. Cleon Hamilton, whose topic is meaningful patient engagement in research. Dr. Hamilton completed his PhD in health and rehabilitation sciences with emphasis on measurement and methods in musculoskeletal health research from Western University. As a postdoctoral fellow in knowledge translation at Arthritis Research Canada and UBC, Cleon is focused on building research projects around patients and partners in research. His current project is PEIRS, P-E-I-R-S, the Patient Engagement in Research Scale. Cleon Hamilton.
Thank you very much, John, and hello, everyone. Today, I'm delighted to speak with you about a research project that I lead, in which I am partnering with patients as a part of my research team. And so the aim of this project, PEIRS, as John mentioned, the Patient Engagement in Research Scale Project, it's aimed at developing a scale to assess the extent to which patients' involvement as partners in the research team is meaningful rather than tokenistic. And so I feel very privileged to work in a team of researchers and patient partners. So my research team includes my supervisor, Dr. Lee, and also 4 patient partners. Allison at the top left, Shannon, who is sitting at the back, Kelly, who will be presenting after me, and as well as Annette, that I'm sure is on Twitter. So these are persons with arthritis who are co-researchers on the team and are involved in various aspects of the research project. I'm also feel very privileged to work with Dr. Bachman on one of our studies. So as a simple, you've heard me mention patient partners. So as a simple way of describing the definition of patient partner, these are individuals with health issues, or their informal caregivers, such as their family members and friends, who sort of take a role in providing their perspective and in helping to conduct research. So the roles that they take on in research could involve as team members on the research team, as research advisors, or in helping to review grants. And so it is important to make a distinction between patients as participants in a research and patients as partners in a research. So when we are thinking about research participants, we are thinking of patients, the research being done on or about patients. But when we think of patients as partners, the research is done with or by patients. Involvement of patients in research as partners is a relatively new practice. It is based partially on the idea that patients or the public in general have the right to be involved in decisions that personally affect them. And so in Canada, it is becoming more recognized as a preferred way of doing research, in that it's more credible approach to doing better research. It is thought that engagement of patients make the patient partners make the research more relevant to answering or to reflecting their needs and preferences. And so in doing this, the research findings therefore better suited for addressing the patient's healthcare needs. So we have better, more relevant research is more likely to help to inform the delivery of healthcare services. Because patient engagement in research is a relatively new and underdeveloped practice, there is still many unanswered questions. Determining the best way for engaging patients in research could therefore ensure that their involvement is meaningful. If patient engagement in research is more tokenistic than meaningful, then we might not get those benefits of improving the delivery of healthcare services. So these benefits might not be realized. So there are two unanswered questions I want to touch on today. The first is, what are the best practices for involving patients as a part of the research team? And second, how do we assess whether patients are meaningfully engaged in a research project? To help researcher partnerships to be meaningful, we developed a framework, the Patient Engagement in Research Framework, to help to guide the planning, implementing, and evaluating of this practice from a patient perspective. So in doing this work, we have come up with what we propose to be meaningful patient engagement in research, in that patient engagement in research is the planned, supported, and valued involvement of patients in the research process within an interactive team and positive research environment that facilitates their effective contribution to help to produce important outcomes while they benefit from the experience. This framework has 8 components. As you can see, these balloons going around the periphery of the diagram. These are components are what we think should be addressed for engagement in research to be meaningful. And I want to touch on a few of these components. So to think of convenience. So we see starting from the top actually, we see procedural requirements, convenience, contribution, support, team interaction, research environment, feel valued, and the last, benefits. The 3 components I want to touch on is convenience. So convenience, it emphasizes the importance of choice and accessibility. So including sufficient time to engage and the flexibility to choose how and when to engage in a research project. So think of setting appropriate meeting time, having accessibility to buildings and so on. Second, support. So in thinking about support, this is the valued resources, including financial and skills instructional support that is offered to patient partners, such as think about training to know ways of engaging in research, and such as also covering the cost for their engagement-related activities, cost of traveling to and from meetings, and so on. And finally, feel valued. So this component focuses on ensuring that patients feel that they are an equal part of the research team, such as providing appropriate recognition and respect for them. So now that we know that how we have a framework to help to engage patients in the research so that it's meaningful, how do we test that it actually works? So our research team is currently developing a scale to assess the degree to which patients' engagement in research is meaningful. This scale is called the Patient Engagement in Research Scale. Its primary purpose will be to test whether interventions to improve patient engagement in research actually works. We created a large set of items for this scale. I'm using the experiences of 18 participants, and these participants were patients of the Arthritis Patient Advisory Board, so they were current or past members of the board. And from these we then asked another set of 12 participants from across Canada who were also patient partners to help us to select the most important items. Currently, we are about to test the peers, pre-test the peers to ensure that it is suitable for assessing patient engagement in research. And our next final step is to launch a large study across Canada to test the scale's ability to measure meaningful patient engagement in research. Thank you very much for listening to my presentation today, and I hope to provide you with an update on our research come ROAR 2018. I'd love to hear your thoughts, and I would be happy to answer the questions that you might have at this time.